Drug-induced liver injury by the paracetamol. If the paracetamol is given in more than 4 grams in 24 hours, it is tolerated. But the dose when exceed more than 7.5 grams in 24 hours, then it is can cause toxicity, hepatotoxicity. Let's see the stages of the paracetamol poisoning. uh, there are four stages. First stage basically asymptomatic up to 24 hours. Asymptomatic, mild symptoms can double, there is nausea, vomiting, and no lab test is positive. Then stage 2 is from the 24 hours to the 72 hours. In this basically abdominal pain is seen and liver tenderness is seen, and LST, AST, LT, INH, all these are raised basically. And the stage 3 is from the 72 hours to the 96 hours, means the 3 days to the 4 days. It is the most dangerous stage. In this, the characteristic findings are basically hepatic encephalopathy, hyperbilirubinemia, basically renal dysfunction signs, and there is a lactic acidosis we can see. And in this stage, death of person occur. The most common cause of death of person is basically cardiac edema. Sorry, no cardiac edema. The death of person occurs because of the cerebral edema and the multiple organ failure dysfunction. And in this stage, the ST80 levels goes very high, around 4000 international per liter. And basically here the histologic finding is zone 3 central lobar necrosis, because in zone 3 the cytochrome P2 even is more, so it produce basically the NAPBQ1 production. So zone 3 necrosis can occur. Then comes the stage 4. Those person who survive the stage 3 can progress into stage 4. Stage 4 is basically recovery phase. Recovery phase, in this the clinically and histologically recovery occur. Clinical recovery is faster than the histological recovery. It takes around 3 months for the recovery. Then some can develop into fulminant hepatic failure, which is characterized by hepatic encephalopathy, coagulopathy, risk for cerebral edema, renal failure, lactic acidosis, and etc. uh, let's see the treatment of this paracetamol poisoning. Basically, if the patient comes, what you have to give. If patient comes in less than 4 hours, then we have to give charcoal. If patient comes in less than 16 hours, then we can give Anestal cysteine. After 4 hours, if patient comes, then we have to uh, uh, we have to basically prognosticate the patient with the help of Rumax Matthew nomogram. And it suggests that it tells that we have to measure the paracetamol concentration in the blood at the end of 4 hours. If it comes less than 100 microgram per ml, then no liver toxicity. If it comes between 100 to 200 microgram per ml, then it is a possible hepatotoxicity. If it comes more than 200 microgram per ml, then it is a positive that hepatotoxicity is present. We can also test the prognosis with the help of other criteria like uh, King College Hospital indicator of poor prognosis. It suggests that if arterial pitch is less than 7.5, that means suggestive of acidosis, then it is a poor prognosis. And other criteria are hepatic encephalopathy 3 or 4 grade, and serum creatinine is high, and INR is more than 6.5. Then it is also poor prognosis according to the King's College Hospital diagnostic criteria. And then let's we see, now we will see the how the doses of the N-acetylcysteine is given. If the patient comes in less than 16 hours, okay, it is given in 3 infusions, first, second, third. In all the threes, 5% dextrose is given. In the first, 150 milligram per kg. In second, basically 50 milligram per kg. In third, basically we give 100 milligram per kg. In first, 200 ml. In second, 500 ml. In third, basically give 1 liter. The timing is, in the first infusion gives for 15 minutes around, and in second infusion over 4 hours, next 4 hours, and then third infusion over the next 16 hours. Thank you.